Hello, everyone. I'm Varun Jain, and on behalf of the Communications Committee of the ASMBS, welcome to another Sword Spotlight. Today, I'm joined by Dr. Philip Dijkhorst, who is a physician at the Dutch Obesity Clinic in Amsterdam, where he is also pursuing his PhD at the OLVG Hospital. We are discussing the Sword article titled Predictors of Improved Psychological Function After Bariatric Surgery. I found this pleasing because it's one of the lesser talked aspects about bariatric surgery. So what motivated you to study this aspect?
Well, actually, exactly for that reason. Psychological function or mental health is not studied very often after bariatric surgery. And it's also not sure whether people experience an improvement in their psychological function or mental health after bariatric surgery. And there have even been some reports mentioning that patients can have a deterioration in their psychological function after bariatric surgery. So that's why we found it really important to dive further into this subject.
So what was the crux of your finding in your study?
So we found that we were using the BodyQ questionnaire, which is specifically validated for people undergoing obesity treatments. And we found that patients did experience an improvement in their psychological function or mental health. And the biggest improvement was seen 12 months after bariatric surgery. And then it's gradually decreased over time, but the improvement stayed better than it was at baseline. And we found that especially patients who had high expectations regarding weight loss before bariatric surgery, but also people who were unemployed, had a history of psychiatric illness, that these patients were less likely to experience improvements in their psychological function.
I see. Okay. I mean, I'm sure that would sound intuitive, but I feel these aren't aspects that we think about much when approaching a patient. Has it changed your way of dealing with preoperative counseling or how you set expectations, which I feel is a big part of anything that we do?
Yes, I think that's really important. And these results only highlighted to me how important it is to explore preoperative expectations. I think I work at the Dutch Obesity Clinic, and all of us see patients who have really high expectations regarding weight loss and that they think they're going to lose 50% of their weight, which is in most cases just not realistic. Yeah. And I think it's really important to at least talk about it with the patient and perhaps, find a way in which they are also happy with a less invasive outcome. For example, 30% total weight loss instead of 50%.
Well, anything surprising or unexpected about the findings or anything else that you would like to highlight from the paper that may not be as apparent just by reading the text?
Yeah, I think another thing that we investigated were surgical complications and what effect they have on quality of life, specifically psychological health. And this hasn't been investigated much in literature. Yeah. And we found that patients who experience a certain major surgical complication, so for example, internal bleeding or internal leakage, even with prolonged hospitalization, that their psychological function was not negatively impacted 4 to 12 months after bariatric surgery, which was quite surprising because you might expect that patients who are hospitalized for multiple weeks, for example, that they will experience a decrease in their psychological function. But we did not find this. And perhaps eventually when the complication is resolved, that patients are not necessarily negatively impacted by the complication, that they can also produce a happy effect, perhaps.
Very interesting. Well, Dr. Dijkhorst, thank you so much for coordinating the time and joining us all the way from Central Europe. Really appreciate it and very excited about the article again. Thank you.
Thank you too.